Thank you. After listening, first thanks the organizers for inviting me here. And I will just take the baton where my counterpart from Netherlands, they have left it. We have been working in the public health sphere, and we are trying to focus on how to build a resilient public health system and see that how things can happen. But I would be more or less focusing on sustaining and sustainability, as well as how we are utilizing the emerging technologies for having a good health ecosystem, as well as how we are using it for optimizing the sustaining our health infrastructure. Before I start with the actual presentation, I will just give you an overview that how the health system in India looks like. It's a mix of public-private providers. It's not only public. The models which the Western world is used to is more or less payers, providers, insurance-driven. That kind of models are there, where the a particular section of population is assigned to a particular area or a particular institution, and the institution will take care of the health needs of that person. That the NHS, as well as the Central American states, as well as the US, they have that kind of this. But here, health is a part of the constitution, where it comes as a state subject. And for the public health, it is in the concurrent list of the constitution. We should remember that. And India being a having a federal architecture, that means most of the health activities happens at the state level. So that's a very interesting dynamics which are there, but nevertheless, over the last many years, the system has evolved. The system has evolved to cater to a population. We do have a very structured, the three-tier system in the public health space. Is all funded by government. Now we are trying to bridge the gap of the catastrophic expenses, the secondary care, through insurance schemes. But the major focus has been on the primary health care, and we have built in institutions. And very, very happy to report that we are having more than 209,000 health institutions at all levels. Talk about the population, in the country we are having around 780 plus district level institutions, that is district hospitals. And now with the vision of our leadership, all the districts would be having a medical college. That means they would be having around 800 bedded hospital, essentially in a district level. And the counterpart in the Western countries is a county or the sub-counties. So we are having a district hospital. Then below the district are the sub-district hospital, catering to a population of around 2 lakhs, that is 200,000. And below that is a community development block, and we do have a community health institution there. I'm giving you structure because most of us are in the opinion that majority of the healthcare happens in the private sector. Yes, the expenditure happens in the private sector. Around 60-70% of expenditure happens in the private sector because of the tertiary care and the high-end care which they provide. But if you look at the footfall and the utilization is more or less 50-60% in public sector institutions. If you visit any of the public institutions, you will find very difficult to negate and see that how I can get a treatment there. They are all overcrowded. I am not going into statistics, but giving a perspective that why we are moving towards a sustainable health ecosystem. Below the community health centers is the primary health center. This is the place which caters to a population of 20,000, where there is no private sector. It caters to around 20-30 villages, and where there is private sector of presence of private sector is not there. The community health center which I mentioned, there also the presence is more or less limited. That is more or less majority of the population is more or less are dependent on the public sector institutions. And why I am giving this measure, so that you can appreciate the resilience which the system has shown during the COVID pandemic. And in a day, we could at least inoculate 25 million people in a single day. Across the globe, it was not possible, but in India, we made it possible because we have a system that is in place and it caters to the needs of the people. Below that, at a population of 3,000 to 5,000, we have a sub-center, which is called as Ayushman Arogya Mandir, which provides a guarantee of 12 services to the population there, including the screening for non-communicable disease. This is the ecosystem which is there, and to augment the efforts, we are in partnership with the private, which are more or less at the district level and the state level, where we have partnership. We are partnering with that. Currently, we are having a bed density of around 7 per 10,000 population, and with an equal distribution in public and private sector. We are trying to see that how we leverage on the capacities which are available. That's why our schemes like PMJ and other schemes are there. So we leverage the potential which is available so that we can provide treatment which is of high quality to the people of the country. So this is the common things, and as we have evolved the infrastructure, we have set in some standards. Some standards have been set in because previously all the health institutions, they were adhering to Bureau of Indian Standards, which was the benchmark. When the Make in India campaign was launched, wherein it was emphasized that we should be having our standards which should be at par with the international standards. For health institutions, we were following the Bureau of Indian Standards, and in 2007 we came up with a Indian Public Health Standard, which are a very sacrosanct standards. Initially it was input-based standard. It talk about how to make a health facility, what are the essential things which are required, what are the equipments which are required. It was in 2007. After that, in 2012, another revision happened because of the other needs and other things. Now recently we have released Indian Public Health Standard 2022, which talks about green and climate resilient infrastructure. One of the important things which is going to affect the health, public health, is the effect of the climate. And we have to see that how our institutions, they are geared up to address the issues which would be posed by climatic change. Unless and until we are prepared for that, we are not able to sustain whatever we have been developing till now. So our institutions, we have in the Indian Public Health Standards, we have listed out, that is available in public domain. Anybody interested, they can just key in the Indian Public Health Standard 2022, and the standards are available across all the facilities which are there. It talks about the clean and green institutions in the public sector. Besides that, now the Quality Council is working towards creating green and clean and hospitals. To begin with, focus is on how to reduce the emissions, because we all see that the energy emissions would be there. But in public sector also, I will, as I dwell into the technologies and the other things, then you will appreciate that what efforts we have been making from the government side in reducing the emission levels, as well as creating structures which are sustainable and which are climate friendly. We are working towards that. And we are very conscious of the fact, I was very happy happy that the last slide of my previous speaker, it mentioned about the efforts taken by the government of India, and I'm very proud that many of the things, recently we have launched a National Climate Action Plan, and we've been partnered, so we are seeing that how our institutions, they also are lined up with in line with the National Health Action Plan for climate change. Because of this climate change, the health system would be stressed out for handling the patients who are coming with heat stroke, as well as the patient with due to the effect of the vector-borne disease, and the drowned due to floods and flood-like situation, that disease would be there. And that our system is more or less geared up towards that, so that we sustain the efforts which we are making. With this, I will just start, because the topic which was suggested by the organizers that I should be speaking on this building a sustainable health ecosystem and the emerging health technologies. Because unless and until, because in coming years there would be increasing use of the technologies. If you are not digital, then you are not in healthcare. That's the notion which commonly is now talked about. If you want to be in healthcare, you have to adopt the digital technologies and you have to be digital. Otherwise, you are just lost somewhere and you won't be able to pick up. And lot of initiatives which we are doing, that is all moving in that direction. How we are using the emerging technologies for our purpose so that we can have a sustainable health ecosystem. So these are the challenges we all talk about. We are all used to that. We should be increasing the health spending and other things. These are all the things which have been talked about. That means we are still budget deficit in public spending, high out-of-pocket expenses. These are important because many of the developed countries, there also they have out-of-pocket expenses, but it is less than the catastrophe. The catastrophic expenses is more than 25%, and we have to aim at reducing the out-of-pocket expenses to less than 25%. Currently, we are at 39% by the efforts. Previously, a decade back, we used to be 72%, one of the highest in the lower middle income groups. So we have to see that how the sustained efforts are made so that out-of-pocket expenses is reduced, so that the stress on the health system is also reduced. Because as the person spending capacity increases, he will invest into many of the wellness activity. As the last thing which my previous mentioned, that we have moved from disease to health, from health to wellness, from wellness to well-being. We are transitioning in that journey, and we are now, the health policy talks about moving from health to wellness, and that's why we have opened around 117,000 health and wellness centers, which are known as Ayushman Arogya Mandirs. That means whole strategic input is there to build a sustainable health ecosystem. Then the health sector is valued at about 200 billion US dollars, and it is growing every year. It's not a small, so that everybody wants to come to India, because as the projections of population happens, that's a bigger market, and market will increase, because we are still grappling with the issue of communicable disease, non-communicable disease, as well as the evergreen, the maternity burden. All the three burdens are there, and the market is going to increase. As the population increases, the bed density, there is a demand for increasing bed density, and a lot of efforts are being made. Even if I commission 1 lakh beds today, immediately in 3-4 months, all would be taken up, because that demand is there. Then besides that, the fragmentation of healthcare is there. That means so many silos are there. Everything is happening in silos. So a lot of efforts are being made to bring and reduce this fragmentation. Before this current assignment, I was with NITI Aayog. During that time, we have started, and first time we have coined this word, the fragmented healthcare system in the country. Otherwise, people were not daring to talk about that. So now we have agreed that we have a fragmented system. Now we are working towards how to defragment that and consolidate the ecosystem so that it becomes more sustainable. Then the aging population, other challenges apart from the three things is the aging population, 60% population, and we would be having a lot of challenges with that. And we have worked on the senior care paper, and which we have already focused that what needs to be done, how to have a interdepartmental coordination, as well as intersectoral coordination, as well as inter-industry coordination. We have talked about that. And we see that how the results would be there. But the budget started, and a lot of discussions are happening, and now everybody is talking that we should be doing something for the senior care so that our system also sustains. Because the senior people, they would be challenging the system, because the treatment needs for the NCDs would be there. We are the NCD capital of the world. If you talk about the absolute number, the diabetes number is very high, the hypertension is there, and they are predisposing factors for the occurrence of your heart disease, strokes, etc. So if you talk about the other things, you have to see like how you invest into your health system so that this catastrophe due to this thing is also being taken care. The medical and pharmaceutical industry, they are responsible for releasing chemicals into this. That's why we are working simultaneously for reducing the AMR due to this the industrial effluents by the pharmaceuticals into the environment. That's also a work area where a lot of work is happening. Then deficit of knowledge on sustainable health system, because it's an upcoming thing. What a system can sustain, that kind of knowledge is deficient. Now we are in the process, as the national action plan is there, we are in the process of orienting, educating as well as training the people in understanding what a sustainable health system is. Then this, why it is needed? We have to provide, as my previous speaker told, that promotion of environmental standards, green public procurement, sustainable waste management. Now, whatever things are there, you might have seen the Bureau of Indian Standards, they have come up with 5-star rating, 3-star ratings, and 4-star ratings. And instead of a normal bulb, now everybody is shifting towards LED bulbs. Instead of a conventional energy, now you are going to non-conventional energy sources. So that kind of also, we are also making attempts into the health sector, okay, how we can use that thing. Then this is the ecosystem. Why we want it? Because it should meet the health needs of the present without compromising the requirements for the future generation. Okay, what we are doing today, that need not compromise the future generation. But most of the efforts which people do, that is all reactive in nature, not proactive. Proactive, that means you have to take care of the future generations as well. These are the 4 things where we are investing. We should have a good digital health technology where we are investing. You might have seen about the National Digital Health Mission. Right now we have digitalizing the healthcare provider, the patient, the hospital, the pharmacies, the nursing staff. After that, all this information would be embedded into the electronic health record, and that would be used for providing services as well as monitoring the health events and providing any responses. You see that the public good which we have made during the COVID time, the COVID application, and you see how beautifully the technology has resulted in reduction in the consumption of paper. We have been increasingly using digital means. Nowadays, many of the things, if you see how the UPI movement, Unified Payment Interface, that has revolutionized the payments which used to happen. The people from India, when they were traveling to the Western world, they were carrying their electronic digital COVID certificate. And you see, you can access, you can retrieve your certificate and you can show your certificate, and that kind of change has happened. And it is having a direct impact on the reduction of this. Then the sustainable infrastructure, as I mentioned that we have Indian Public Health Standards, which talks about how to create an infrastructure which is climate friendly and is resilient. Then the health information system, we are trying to see that how the disease surveillance mechanism, because in health we are having 2 aspects. One is provision of the services, other is the monitoring the diseases, so that we can take a prompt action. We are investing into the health information system. And apart from that, we are trying to see how the emerging medical technologies are also built into the system so that we can take care of that. Then we are utilizing the blockchain and other technologies for our financial requirements. Then this is the emerging technology. I won't be dwelling much because I think time is running fast. Then AI, IoT, blockchain and telemedicine. These are the things where in the health sector we are investing into that. We have to enhance the diagnostic accuracy. As I mentioned that in the digital, using the technology, we are now currently creating the IDs. The IDs would be embedded into the electronic health records. And the electronic health records can be used for training the machines, generating algorithms, so that you can have an enhanced diagnostic accuracy, and it can improve the patient engagement, optimize operation. So why so many things are happening in the medical sphere? Because increasing use of technologies is happening. If you see how the vaccine trials and other things have announced, it was the use of technology. Now I can, with the use of the algorithms or other things, I can predict that what kind of results would be there. So it has cut short the trials which used to take 10 years, now you can have results in 1 year, 2 years. You see that how accurately you can, from a hospital based to technology enabled whole care. COVID is the best example, how we have seen that at that time we have understood the dynamics of the disease. We were not having bed capacities. For 2 weeks, 3 weeks, the system was overwhelmed with so many cases during the second wave. And it was the technology which has aided us in managing the patients at home. Though some chaos would be there here and there, just why I have told that the system was overwhelmed for 2-3 weeks. And in that time also, it has taught us that how the technology can be used for providing home care. And as a result, what you have seen that now the home care industry is now growing, and it will be sustaining now. So that kind of new things is also emerging. Then besides that, there are many hard to reach areas. In tribal areas where the in the villages there are habitations. Intra-village habitation distance sometimes range to 9 kilometers. One person is living here, he is living on the other mountain. One household is there. How to send anything to that? That's why we are increasingly using the drone technology so that the conventional mode of transport using the petrol and the fossil fuels, that is avoided, and immediately the person within a half hour, the medicines and other things have been. We are trying to foster a culture of research and excellence. As I mentioned earlier, we have to be very proactive rather than reactive to the situation. Then this is the other disruptive technology which are shaping our healthcare. That is the wearable sensors, smart glasses, augmented. I think I won't be giving details of that. These are emerging health technologies in the Indian healthcare ecosystem, which is happening. Artificial intelligence we are increasingly using. Artificial means it's artificial. Somebody is creating that intelligence. We should not be worried about that. Because if I know the content, I can train that machine in using collective intelligence to give a predictive response. But in the medical field, you have to see that how the predictive response is to be interpreted. It has to be interpreted by a person only. It can only give predictions. If I train the machine, if I say increase the sensitivity, it can give a false positive also. So we have to be always cautious when we are using it. Then these are the other things, Internet of material things, clinical and non-clinical, these are there what we are using. Then these are the technologies, telemedicine and telehealth. The access issues, still after having a network of around more than 200,000 health facilities, we do have access facilities. We do have HR challenges. That's why the leadership says that we should be investing into creating more health professionals. 75 more medical colleges would be coming up as announced. But still after that, there are a lot of vacancies. As I mentioned that the first contact of the community with the medical officer is at 20,000 population. And we do require around 28,000 medical officers. That's the gap which is there. Besides that, with increasing care, a lot of specialization is happening. A lot of changes are happening. We need to reach to the person. So during COVID time, one of the major initiatives which was happened was telemedicine, and it has changed the way we work in the health system. Telemedicine is nothing but right now we are leveraged that opportunity, and in the public health system you see that how it is working beautifully. That means a person who is coming to the 174,100 to which I have mentioned, the institutions are there. A nursing cadre person is there. If a person wants a consultation with super specialist, you are all from the towns, and getting an appointment with a specialist takes time. But in the public system, if you go to a center, immediately by a video call, the person is connected, and after consultation, after examining the patient, because as we give instructions during our ward rounds to the nurses, the similar instructions are given and the treatment prescription is generated and the medicines are provided free of cost. All the medicine which are being given, they are medicine and diagnostic, they are free of cost in most of the government institutions, except a very minimal user charge in some of the institutions. So that means telemedicine is being rampantly used across the country. And I'm very happy to report that more than 300 million consultations have happened by this month. You see the potential of that, how we are leveraging it, so that the pressure strain on the health system is less, so that it is eco-friendly also. The commuting time of the person is also saved, as well as there is a lot of saving on other aspects. Then the other thing is a blockchain in healthcare, because they are always concerned that the patient security, the data security would be there. So increasingly they are using it to using this blockchain, so that it doesn't allow, if the rights are given, it doesn't allow that if my records are there, nobody else can access that record. And you can always use this kind of technologies which are available. And it is being used. These are other use cases in India. The cancer screening software is there. We all have to train the machines before it gives the good results. So these are all the technologies which we are using to create a health ecosystem which are to be sustained in the coming days. We are increasingly using it because the vision of our current leadership is by 2047 we should be a part of developed country. For that, the Viksit Bharat vision. For that, at that time, our population would be 1.7 billion. That's the projected population. To cater to that population, we have to use the technology as a means. Otherwise, at that time, if you talk about the doctor population ratio, we would be requiring around 56 lakh doctors. Currently, we are 18 lakh doctors. And of which somebody would not be working. So that kind of vision and thinking is happening, and so that we can create an ecosystem which is self-sustaining and can cater to the needs of the people. Then the other thing is e-health initiatives which the ministry is taking to provide services to people, 1.4 billion right now. And maintaining a case record of 1.4 billion is very, very humongous task. So we have had a lot of e-health initiatives which are focused. These are all lists. I think PPTs with the organizers. You can always take a copy. We don't have any copyright. You can not free to use that. Then we do have other institutional mechanism which are there. Then these are other e-initiatives. The COVID, it is a public good, and we have been able to give it to more than 100 countries as a public good, as a gesture, goodwill gesture. It has been given to more than 100 countries. You see how beautifully immunization session lies from logistic tracking, immunization sessions organization, as well as the beneficiary registration, as well as the issuance of the card and the due list. All the things can be generated by that. So that kind of thing is being given. So it reduces, see that how the system becomes more efficient, and you can sustain a lot of efforts. No need to maintain records and other things. It is already there. If you want something, that information is available. Then the e-hospital, the e-Raktakosh, all the things are getting digitalized so that we are increasing dependence on paperwork and other things is reduced. Then the energy efficient solutions of healthcare settings. The IPHS 2022 talks about how to reduce the energy consumption. It talks about the energy audits. It talks about the use of the other conventional methods of this. So solar rooftop is one of the examples which is there, and I think more than 20,000 health institutions, they are now solarized. There are two models, the off-grid model, the in-grid model. So we are trying to see that which model will succeed. But increasingly the efforts are being made. And during the flood situation, this was the only way of communicating because the usual electricity connections and other were disrupted. And they have communicated with that. Just 5 more minutes. Then these are the public-private partnerships which are there. So you see that how we are already trying to collaborate with the private sector so that we can create an ecosystem which is there. Then these are the challenges for adoption of the healthcare in the country. The absence of healthcare regulatory body, then the low collaboration, unaffordability. Because we have, for sustaining and for creating a health ecosystem, we have to increasingly focus and invest into the technology. Then this is, we're trying to find out, then this is the future outlook. After doing all these things, we are trying to see that how we move from providing a mass scale health services to a personalized medicine. That's a new development which is happening elsewhere. And second is genomics, AI-driven diagnostics, and this. This is a vision that when we reach there, we can become an affordable and high-quality healthcare ecosystem. This is our vision. And since it was a very vast subject, I try to be very concise. There are a lot of things to share. But this PPT is with the organizers. You can always have a copy of this. So we don't desist anybody from copying or using this thing. This is all from my side. Thank you very much.